I want to start today with something I see all the time, and it often catches families completely off guard. A senior moves into assisted living or memory care, the family feels relieved. The big decisions are finally made, and then a few months later, there's a medical emergency that no one saw coming. It's not a fall, it's not a medication issue, it's not even dementia progression, it's an untreated dental infection. Hi, I'm Dale Corpus, a senior transition specialist and real estate expert based in the San Francisco Bay Area, and you're listening to the Simplify Senior Transitions podcast. I created this podcast because senior care decisions are overwhelming emotionally, financially, and logistically. And my promise to you is simple. Every episode brings real conversations, practical guidance, and trusted expert insight to help families move forward with confidence instead of stress. One of the most overlooked yet most critical parts of senior health is oral care. Dental issues in older adults often go unnoticed. Seniors may not complain of pain. They may struggle to advocate for themselves. And once mobility challenges, transportation issues, or cognitive decline enter the picture, routine dental care often disappears entirely. But poor oral health isn't just about teeth. It's directly connected to nutrition, infection risk, heart disease, diabetes, cognitive decline, and overall quality of life, yet it's rarely discussed when families are choosing assisted living, memory care, or skilled nursing. That's why today's conversation matters. My guest today is Gerardo Reinaga Gonzalez, a registered dental hygienist in alternative practice, or RDHAP, one of the most specialized and rare dental licenses in California. Gerardo provides mobile dental hygiene services, bringing essential oral care directly in assisted living communities, memory care, skilled nursing facilities, and private homes throughout the Bay Area, serving seniors who otherwise might have no access to dental care at all. In this episode, we're going to talk about why dental issues among seniors are increasing and the early warning signs families often miss, how oral health impacts dementia, heart disease, diabetes, and longevity, and what families should be asking senior communities about dental care but usually don't, what an RDHP actually does and why so few exist, and how families can prevent painful, dangerous, and costly dental emergencies before they escalate. This is a conversation every adult child, caregiver, and senior living professional needs to hear. Let's dive in.
Welcome to the Simplify Senior Transitions podcast, where we help families navigate senior living, real estate, and everything in between. Hosted by Senior Transition Specialist Dale Corpus, this show brings you expert insights, real solutions, and stress-free strategies to make senior transitions simple. Ready to dive in? Let's go.
Gerardo, how are you? Welcome to the show today.
Hi, Dale. Thank you for having me.
Oh, you're welcome. So, Gerardo, for people who have never heard of an RDHAP, can you explain what that means and why this license exists?
Definitely, yes. Thank you, Dale, for the opportunity to be here today. And yes, my name is Gerardo Reinaga. I am the owner of Amazing Smile. And what an RDHAP stands for, it stands for Registered Dental Hygienist in Alternative Practice. And this license was issued about more than 20 years ago to reach people who are not able to make it to a dental office. And these people are people with dementia, people with intellectual and developmental disabilities, Down syndrome, ADHD, agoraphobia. I mean, you name it, anything that prevents you from going to a dental office. This is the reason why an RDHAP license was developed by the state of California.
Okay, perfect. And what first drew you into working specifically with seniors in assisted living, memory care, and in their private homes?
Yes. So back when I started doing dentistry and I was helping the underserved communities around the Bay Area. And then when I moved to Oregon, one of the doctors that I used to work for, we were seeing patients with dementia, patients with in wheelchair bound, patients who were not able to move around, who were not non-mobile. And then when I came back to California, my mom, she's elderly now, and then she needed my services. And my brothers were asking me, "Hey, can you clean mom's teeth?" Of course I can, because that's what I do. Legally, I was not able to do it because I didn't have this license yet. So that's what prompted me to go back to school and became an AP so that I can service my mom. And then eventually, if my mom needs my services, I figured out there were other parents in the Bay Area who needed my services. So thanks to my mom, I was able to go back to school and and become an AP. So that's what prompted me to get this license.
Yeah. Something I've learned over the years is that families often underestimate the importance of dental health. And so, in your experience, what are the most common oral health problems seniors face?
Is one of the most common problems, say, seniors facing at the moment when it comes to oral health is gum inflammation, also known as periodontal disease. So gum inflammation can go untreated for many, many years before it shows any signs. But when it does, I don't want to say it's too late, but we're reaching that point where the infection has become very aggressive to the point where now we're having toothaches due to cavities, and now we have to do extractions. So that's one of the major points that I'm facing right now with my seniors is periodontal disease that again eventually will lead to something major.
Okay. A related question is then what are the consequences when dental issues go untreated in older adults, especially those with memory impairment?
So one of the things that again it will lead into will be tooth infections, and then eventually, if it gets left untreated, even longer, pain, which nobody wants to go through, especially our seniors, especially people who are not able to communicate that they're having pain. Those are really hard decisions to make or hard ways to find out what's going on. So it will lead into infections, tooth loss, and eventually, I mean, hopefully it doesn't happen, but an emergency visit to the emergency room to treat it with IV antibiotics or whatnot.
Yeah. Now, I want to talk about how like oral health and overall health are really intertwined, right? Can you explain the connection between oral health and dementia progression?
Definitely, yeah. So there is a study going on right now. They just released it not too long ago,
Yeah.
where it shows that the bacteria in your mouth will travel through the vein and it will cross a brain barrier and
Yeah.
it would start producing plaque. Once it starts producing plaque in and around the brain, that's when we see dementia progression or dementia incline.
What about the link between gum disease and heart disease?
It's pretty similar to what I explained with the brain. Once that bacteria that we have in our mouth, we have different bacteria in our mouths, but once it starts traveling to different parts of the body, again, it will cause plaque, build up inflammation. Once it becomes inflamed, the heart will get inflamed. Or, for example, if it goes to a joint replacement, like a hip replacement, knee replacement, same scenario. Once plaque starts to build up, inflammation will build up, and eventually, the heart joint replacements will fail and they will need to be replaced or redone or taken out.
Yeah. How can dental issues even impact nutrition, hydration, and the senior's appetite?
Yes. So as we age and we start having less saliva and the increase of periodontal disease, pain, eventually people with dementia, again, who are not able to communicate well, they don't know what's going on. They just know there's pain. I mean, physically there's pain, but emotionally or mentally, they're not able to communicate that there's pain. So how is that going to decline as far as your overall health is? I mean, you won't be able to have proper nutrition. You don't have proper nutrition, then health wise, it will start declining, not just cognitively, but also your overall health will start declining. You will lose weight. If you lose weight, then, I mean, there's a serious problem there too.
For diabetic seniors, what should families know about oral health risk?
One of the biggest risks is, again, periodontal disease. And with diabetes, it takes longer for a source to heal.
Yeah.
It's a moist area, but also because it's a moist area and because of the diabetes, then any wound healing would take longer or it would not heal properly. And it can cause tumors, overgrowths, or, and I mean, major problems on the road. But
Yeah.
one of the biggest thing is wound healing. Wound healing will be delayed
Yeah.
and excessive bleeding eventually.
One of the things that's unique to your business is that I know you provide dental and oral health services inside senior communities. So this question was curated for you because I know not many people do that. When you walk into an assisted living community, what do you typically observe about residents' overall or oral health?
So when I walk into an assisted living community, one of the things that I observe in people's oral health is how many people are getting care, how
Yeah.
many people are not getting care, who's doing the care,
Yeah.
what type of care they're receiving, how
Mhm.
often they're receiving it. Are they on top of their daily activities
Okay.
as far as brushing, flossing, water picking? Those are the things that I pay attention to when it comes to the oral health of the residents in any community that I go to.
Okay. Now, are senior living staff trained to notice early signs of dental issues?
Unfortunately, they're not. Why? I'm not sure. I've been trying to figure that out for a while, why they're not on top of the oral health regimen on a daily basis.
Okay.
But most communities, I don't know if it's a liability. Um, I wouldn't be able to answer your question. But yes, they're not trained to do any oral health manipulation for their seniors. I know they can be added into their treatment plan. Families can ask for it. Some facilities would do it once they ask to be added into their treatment plan. Some facilities would not do it. Again, I think it's probably because of liability risk of inhaling, aspirating, you name it. Yeah.
Yeah.
But yeah, most senior living facilities, they are not trained to help with oral health.
Makes sense. Now, what should families ask a senior community about dental support before choosing a place for their loved one?
Yes, a great question is the community working with a dental provider? Do
Okay.
they have somebody on board?
Okay.
Well, as far as I know, legally, there's supposed to be a dental provider in each community.
Okay.
Probably not seeing every single patient, but at least on the record. So, what a great question would be: are you working with a dental provider? How often does he or she comes to the community?
Yeah.
How long have you guys been working with that provider? So, those are great questions to have when you're choosing a residence for your loved one.
I'm going to backtrack a little bit and tell me more about your business. Like, what geographic areas do you cover in the Bay
Mhm.
Area? Where are you located, and how long have you been in business?
Yes. So my geographic area is pretty much a whole Bay Area, from Santa Rosa down to the peninsula, such as Belmont, Hillsborough, down to San Jose, and then coming up to Brentwood, Antioch, all the way to San Leandro, Oakland. So pretty much in and around the Bay Area. So 60 miles from where I'm located, which is in Pinole. So
Okay.
60-mile radius, that's my service area.
Got it. And how long have you been in business and working with senior living communities?
Yeah, so in this January, I'm actually starting my fourth year open with Amazing Smile. Now, as far as being in dentistry, I've been in dentistry for more than 25 years.
Can you walk us through what a typical mobile dental hygiene visit looks like?
Yes. So first, the family members will call me, schedule an appointment. Then I will send them a link for them to fill out the paperwork, such as medical history forms, consent forms. And then once the appointment date comes, for example, if it's tomorrow, I go into the facility, introduce myself. If it's the first time being there, and then I will set up my equipment. All my equipment is mobile, such as X-rays, exams, dental cleanings. All the equipment that I bring with me is mobile. So I will set it up, then I would do an examination with the patient, intraoral, extraoral examination. I would take X-rays if they're needed. I would take intraoral photos. And then once I have that information, once I finish a completed examination, then I will reach out to the family members if they're not present to let them know what my findings are. Once I show them my findings and explain what my findings are, then we would do the actual cleaning. And it could be a regular cleaning, deep cleaning, and any other services that the patient might need.
Yeah.
And then once we finish, then break it down, clean all that equipment, and then move to the next patient.
Okay. What makes mobile care so critical for seniors who can't leave their home or room?
Oh, it makes a world of difference. Most of these people throughout their lives, they've been going to a dental office every 3 months or every 6 months or at least once a year. And now that they're in a facility for whatever reason, but whether it's because they have Alzheimer's
Yeah.
or just aging and they're not able to reach a dental office anymore. So this is a life changing service that we're providing. we're able to bring quality dental hygiene services and continue with their oral care that they've been receiving throughout all of their lives.
How do you adapt to seniors with dementia who may resist care?
Mhm. Great question. So yeah, so it's funny because when you're in school and they teach you about dementia or Alzheimer's or Down syndrome, everybody gets put into these little boxes. You know what I mean? So they say if they have dementia, they're going to act this way. If they have Down syndrome, they're going to act this way. But once you're out there in that real world, everybody's different. So all you have to do is just adapt to their surrounding and see what their triggers are. Some people might be triggered with the noises that we use. Some people might be triggered with the light that we use. So just adapting to their needs.
So I want to segue into preventing even bigger problems. What are the earliest warning signs of oral health trouble that families tend to miss?
Bleeding. Bleeding is a big one. For
Okay.
some reason, when people see bleeding, when they floss, they're like, oh, I'm not going to floss anymore because my gums are bleeding.
Yeah.
That's an early sign saying floss more to
Mm,
remove more bacteria. And a lot of people, as soon as they see bleeding, they get scared and they stop flossing. So that's a big sign that a lot of people are missing personally and with their loved ones. So as soon as you see bleeding, seek care, go see your hygienist. Another sign that a lot of people miss, especially with dementia people who are not able to communicate that there's pain, is one, their appetite is not there anymore.
okay.
Or they're touching the side that hurts all day long because they're in pain. They just don't know how to express it. So as soon as you see bleeding, loss of appetite, they're touching their face on a daily basis or all day long. Those are early signs to let you know, hey, there's something going on with my mouth. Please take care of me.
What about frequency? How often should a senior in assisted living receive dental cleanings?
I'm going to give you two answers to your question.
Okay.
So we're supposed to be seeing, the general population is supposed to be seeing a hygienist every 6 months. Okay. In a healthy mouth, it's every 6 months. If there's periodontal disease, every 3 to 4 months.
Okay.
Okay. So that's 3 to 4 times a year. Okay. Now going to a community, assisted living community, Alzheimer's community, these people are no longer taking care of themselves anymore. They're not brushing properly. They're not flossing properly. More bacteria will accumulate. So these people, they need to be seen more often. So again, every 3 to 4 months will be a good recall for most people. Again, who's experiencing some type of gum inflammation. So to answer your question, every 3 to 4 months, probably.
Noted. Now, for families on a budget, what are the highest impact things they can do to reduce dental urgency?
Okay. Daily brushing and flossing. Okay. It only takes a couple of minutes or maybe a little longer with people with dementia just because they need to take breaks or they're not open to having somebody in their mouth. But yes, a daily brushing, daily flossing, tongue scraping or tongue cleaning, it's another thing to do on a daily basis. And that will prevent more dental visits and eventually it will be easier on the family members' pockets if that's one of the issues that they're facing, financial restraints.
Okay. What should caregivers know about toothpaste, toothbrushes, swabs, and oral rinses?
Yes. So toothpaste, a lot of people ask me, what's your favorite toothpaste? That all depends on the situation of the patient. For me, I know a lot of people, they're not pro fluoride. I love fluoride because I know the benefits that it brings, but also I know that there's side effects too, just like anything else. If you overdo it, you're gonna have some side effects. So for people who are still able to spit out the toothpaste, always use fluoride toothpaste. Now, as far as the brand, the flavor, the color, that's all personal preference,
Yeah.
but make sure that there's fluoride in it if the patient's still able to spit it out. If they're swallowing the toothpaste because, I mean, they just think it's food, then use something more natural like Tom's natural toothpaste and stuff like that. So, yes, I do understand how important fluoride is, but then I also understand that there are side effects.
Um, let's talk some real stories. Can you share a story without naming names, obviously, of a senior whose health dramatically changed once dental issues were addressed?
With this question, I'm going to be a little bit selfish, okay? And I'm going to share a story that helped me figure out which niche in dentistry I was gonna go into.
Okay.
So there was this daughter who called me. That was early when I opened my practice, back late 2022.
Okay.
She calls me and she asked me, "Hey, can you come see my father? He has advanced dementia. He's living in a assisted living community, and he's not brushing, he's not flossing. But I know there's bleeding in his gums. Can you come see him?" And I was brand new to my practice. And I said, "Yes, I'll come in." When I saw this gentleman, super nice guy. Yes, he didn't like anybody be in his mouth. So
Right.
it took me a couple of times before we built that report.
Yeah.
But once I was able to see the progression from having a not healthy mouth to having a healthy mouth, and him being able to eat again, drink again, the things that he liked, that's when I knew I wanted to focus more on dementia patients. He was actually very patient with me because I was new to dementia patients. So he was really patient with me about showing me what his needs were. His family members came on board and they showed me how to care for him. The caregivers in the community, they came in as well and said, "Hey, he likes this, he doesn't like this." So even though I had been in dentistry for more than 25 years, working with dementia patients is such a special niche that I wasn't exposed to.
Yeah.
So thanks to him, that's when I knew that I wanted to focus on Alzheimer's patients. And that's when I went back to school again and get certified with my dementia certification to be able to help this community. Because I knew that they needed me and I knew that I was going to be able to make most of the difference with this community. So it's not so much how I helped them, it's how he helped me figure out which route I wanted to go to. So it was thanks to this gentleman. Unfortunately, he's no longer with us,
Mhm.
but I hold him very deeply to my heart, thanks to all the teachings that he provided me with throughout the time that I treated him.
Yeah. It probably also opened up your eyes as to how much of an underserved community, it is. You're bringing a lot of value and you add an extra level of care,
Mhm.
to oral health. Have you ever caught something serious that a family didn't know was happening?
Yes. So there's a couple patients. One of the patients, there was an overgrowth in her mouth, in her tongue. It was on the right side of her tongue, but there was an overgrowth of, I want to say, it was 9 millimeters by 10 millimeters
Okay.
wide. So it was a pretty large growth. They had to do a biopsy. And then, unfortunately, after the biopsy, a couple of months later, she passed away. So we weren't able to find out if it was a benign tumor or malignant tumor, but the
Mhm.
growth was pretty significant. So more likely it was a malignant tumor. But again, unfortunately, she passed away. So we were not able to proceed.
Yeah.
The second patient was a denture patient. She wears dentures, full upper dentures and full lower dentures, and they were ill fitting. So they were ill fitting and they were rubbing against her gums. And eventually, with the friction that was producing the ill fitting dentures, her gums got inflamed and
Yes.
eventually that bone got exposed.
Oh,
So again, we had to do major surgery on this patient, not myself, but I had to do the referral to an oral surgeon to do major reconstruction because she was losing some of her bone. I don't want to say I've been lucky to see these things, but I've been lucky in a standpoint of education wise. I've been pretty lucky to find these things and being able to take care of them. It's been great. So yes, unfortunately, I have been able to see some major problems, but also we've been able to take care of them.
yeah. Yeah. Now, how can families advocate for better dental care inside senior communities?
By them asking the executive director, "Hey, can we bring a dental provider on board? Do you know somebody that you've been working with already? If not, how can we bring one? Can we bring workshops to the community? Can we bring a dental provider to show my loved ones and the caregivers how to properly brush and floss the residents' teeth?" So that's how family members can advocate by asking the director of the facility to bring workshops, dental workshops into the community.
What do assisted living and memory communities get right? And where is there room for improvement?
Well, unfortunately, dental is something so easy to forget that most dental communities that I go to, the first thing that they say, "Oh, I didn't know you existed."
Yeah.
Okay. So there is some room of improvement by reaching out to hygienists, to mobile hygienists, bringing us on board to your communities. So that's one way to improve the community by having a dental provider in their books that they can work with and that they trust. So yes, so that's how they can improve.
What myths about dental care for seniors do you want to correct once and for all?
That all toothpaste is the same for all. I've been to a few communities that they always use Colgate only just because the caregiver loves Colgate. Not everybody can use Colgate. Again, like I explained earlier, not everybody can use fluoride, or they might be allergic to the food coloring that's inside the toothpaste, or not everybody likes a runny toothpaste. Some patients might like something more pasty and not so runny. So yes, not all toothpaste are the same.
Okay, understood. For someone listening who feels overwhelmed and guilty that they missed something, what would you tell them?
That it'll be okay. Seek help. Seek the right help, not just any help. Do your due diligence for family members. I am a great provider. I'm not perfect, but I am a great provider. So do your due diligence as far as family members goes. See who you're bringing to your loved one. Do your research. Do they have a license? How
Yeah.
long they've been in the dental field? What services can they provide? And for communities, we're here for you. You don't have to do it all yourself because the communities are already doing so much for their residents that dental again gets left behind. And they might think, oh, we're going to get fined for not having a dental provider, or we're not doing the daily activities of brushing and flossing.
Yeah.
Oh, that's what I'm here for. So, yes, that's something I can tell you. You're not alone. I'm here for you guys.
Love it. And finally, any final remarks and how can families reach you if they want help or have questions?
Yes, they can actually reach me in any way, shape, or form that they feel comfortable with. I only have one number, and that number is my personal number and my work number. So if somebody calls me, you'll find me. You won't get a front office person. It'll be the provider who's going to take care of your loved one. It's going to be the person who's going to answer your phone call as well. So you can call me, text me, email me, social media. I'm on social media. I'm everywhere on social media. So any way that you feel more comfortable looking for help, I'm here for you to answer your questions.
Yeah. And to keep things easy for everybody listening or watching, I'll have his contact information pasted in the show notes. So, Gerardo, thank you so much for sharing your expertise today. Dental health is something families rarely talk about, yet it affects everything: cognition, nutrition, energy, comfort, and dignity. Your work is giving seniors access to care that truly changes lives. And for everyone listening, if your loved one is aging, don't wait for a crisis. Ask the questions, schedule the screenings, look inside the mouth. Literally, you can prevent so many avoidable emergencies. And before we wrap up, if you're new here, this is a Simplify Senior Transitions podcast. My mission is to make the world of senior care less overwhelming and more human. If this episode helped you, please take a moment to leave a review on Apple Podcasts or Spotify. Reviews make a huge difference. They help more families find the show right when they need it the most. And if you know someone who could benefit from this conversation, please share this episode with them. If your loved one is considering senior living and you're trying to figure out what to do with their home, let's talk. You can schedule a free consultation and learn more about my services and how I help families at www.simplifyseniortransitions.com. If you prefer quick questions, DM me anytime on Instagram at Sold by Dale. Thanks for tuning in. Gerardo, one last thank you for being on the episode with me today.
Thank you, Dale, for having me.
You're
I appreciate that.
very welcome. And for the rest of you, I'll see you next time on the Simplify Senior Transitions podcast.